Thank you, welcome. Thank you for coming to the December team brief. First of all, I can see some Christmas jumpers in the room, so happy Christmas to everybody. It's not long now, and at Christmas though, it's always a useful time to reflect on the year that's gone, and reflect on the year that's coming and all the priorities. I've done over 50 service visits in the last 12 months to many of our services, and I am struck every time I go to different places about the care and compassion that I see, the amount of energy and time and commitment that people put into their jobs on a day-to-day basis. These jobs aren't easy. They're busy. It's a lot of emotional commitment to these things, but people come back day after day after day, and I'm truly thankful, as I know many of our families and patients are. 97% of the people that access services would recommend the service to their friends and family, and we should be proud of that. So what have we achieved over the last year? Well, I'll summarise a few things. I'm sure there is lots of things I'll forget. Just wanted to first of all comment that it was the NHS's 70th birthday, and it was great to see over 120 tea parties across the NHS. The NHS is a hugely well-respected institution for good reason too. It provides great care at the point in time when people need it most, and we should be proud of that. What have we done in LPT? There are some things that have really, we've seen a huge, great difference over the last year. So our abilities to supervise each other and to record that. 2 years ago, our supervision rates were 25%. Over 80% today across all of our organisations. Supervision is really important in terms of our resilience and going forward. But not only that, our appraisal rates, our mandatory training rates, our abilities to be compliant with the Mental Health Act, fill in all the forms, explain to patients what we need to be doing. We've actually reduced agency as well across the organisation. So all of those things have improved massively, and agency has reduced, which is great. We've also shown some real innovation across, and that's one of the things as I go around the organisation, I see people expressing their ideas, and I'm here in the Braggett unit today, and just at the Braggett unit there's lots of different innovations. I can think of two, I'll get it right, make in, not take out, and the sanctuary on Aston. Both have arisen out, I think, out of LIA events. They're people's ideas, which we've helped support them, and they've been real bonuses for patient experience, and so thank you. But we need more of those things, and not only we need more of them, we need to make sure the ones we're doing, we think, well, how can we spread that to other parts of the organisation as well? Because if it's a good idea somewhere, it's probably a good idea somewhere else. And this year we hit 1,000 nominations for Valued Star Awards as well. So over 1,000 people have been nominated for Valued Star, and that's one of the highlights of my month, when I get to go out and celebrate with people and surprise them in their workplace with a Valued Star certificate. Really good. And we've also made progress in CAMS. We're reducing our waiting times for urgent and for routine appointments, and actually we're now beginning to see a reduction in the waiting times for treatment as well, which is great. And I also want to celebrate the growing of our perinatal services. They're doubling in size at the moment to provide mental health services for women who have been just before their birth or in the year after birth as well. Really important to get that early intervention right. So lots to celebrate. So next year, what's our priorities? What are my priorities for next year? As you know, we've got a big transformation programme, the all-age mental health transformation programme. We've got to get that right. We've got to get the care pathways right across the system for people with mental health problems. Absolutely critically important. We've got too many people waiting too long or having to go out of county. We've got to get those processes, and we've got to get that working better. We've also got to focus on how we do things and the culture in which we do things, and how kind we are, and the processes and the quality improvement mechanisms. How do we improve what we do, but with the right culture and the right values? And we've got to continue to focus on that, because our staff survey still says we've got work to do to make sure that we improve things in the right way. We don't just send an email, we do things in the right way. And we've also got work to do in terms of our race equality work, how our BME communities in this organisation feel, whether they feel they get equal opportunities across the sphere of jobs. And there is more work to be done on that, and we'll be focusing on that in the new year. We're asking a team to come in from outside to help us with that in the new year. Two biggest risks in the organisation are workforce. Won't surprise you. We've got too many vacancies. There are roughly 200 registered nurse vacancies in this organisation as it sits today. That's a lot. And I don't see any immediate prospect of being able to fill all of those. So we've got to focus on new roles. We've got to focus on nursing associates. We've got to focus on apprenticeships. We've got to focus on pharmacy, therapists, AHPs. We've got to focus on the workforce that we can get in order to make sure that care is at its best. And the other big risk is our estate, our buildings. We've got too many buildings that are not quite fit for purpose. Including probably the one I'm sitting in. The CQC have made it very clear that over time that we would need to be getting rid of dormitory accommodation. Privacy and dignity is really important, and I think we'd all share that view. But doing that is not easy, and it probably means completely rebuilding the Bradgate unit. We will be getting a strategic outline case in the new year and working with our partners to think about how we can fund a complete new build of our acute inpatient site. And that's something that we've really got to prioritise and move on at pace, because that's something we need to do for our patients and for our staff as well. Those are two big things, the workforce and the estate, that we need to get on with next year. And then finally, I just wanted to one of the best nights of the year, one of the nights I enjoy most, is the Celebrating Excellence night, where we celebrate people's achievements. And the nominations are open at the moment. So if you've got a colleague that you feel is deserving of a Celebrating Excellence award, then please nominate them. They're great to go through and judge, and they're great to spend the evening with the shortlisted people and the eventual winners. And it's a great night we have together. So please, if you want to nominate anybody, and please do so. Thank you very much for listening.